Thanks for watching Hello Baltimore County. I'm here with Dr. Linda Grossman, Director of Clinical Services for Baltimore County. Thanks for joining us.
Pleasure to be here.
We're here today to talk about immunizations, vaccines. Tell us why it's important and for whom is it important to get vaccinated?
Well, it's important for two reasons. One is that it protects the individual actually getting the vaccine from very serious diseases. I'm old enough that I remember when there were many people who had major complications from things like measles and mumps and things like that. And certainly polio caused paralysis in many people. And thanks to the immunizations, that's pretty rare now for people to have complications of those things or even death. The other reason that it's important for people to get immunizations is that if a sufficient number of people have the immunizations, then it prevents the disease from spreading and it protects those people who can't get the immunizations for some medical reasons.
Okay, so who should get vaccinated?
Well, there is an extensive schedule of appropriate times for people to get it. There's a schedule for children and there's also a schedule for adults. Often in the United States, children do pretty well and the adults don't do so well with getting their vaccinations that they should be getting. Tetanus is a great example.
Yes.
That people forget that they continue to be at risk for it even though they're adults.
And you don't think about a tetanus shot until you cut yourself.
Right.
Yeah, but tetanus is a big deal. My family member, cut himself, and we went and got the tetanus shot, and we were reading online thinking, oh my God, this is not a minor issue.
Yeah, no, tetanus is a very serious illness that has a high death rate if you get it.
Yeah, quick question. With the tetanus shot, there was the option of getting a whooping cough shot along with it. What is the deal with that?
Well, it used to be that we thought the whooping cough vaccine that children got when they were very young protect them for life, and we now know that's not true. So that we are finding increasing numbers of teenagers and adults getting whooping cough. It's not such a serious illness for them, although they may have a very prolonged cough for a long period of time. But the bigger risk is those teenagers and young adults with whooping cough can then infect babies who haven't yet gotten their full series. And for a baby to get whooping cough, it has a very high rate of children ending up in hospitals on respirators, and some of them die.
Oh my God.
So it's important to protect the babies who are not old enough yet to have gotten the full protection.
Okay, and I think the big question that still remains, despite wealth of scientific evidence to the contrary, is this whole question about vaccinations causing autism. That's been completely disproven, right?
Yes. In the United States, they did, being very cautious, take mercury out of all vaccines in 1990. Okay. 2000. So that we've now had 11 years with none in there except in flu vaccines. And the incidence of autism has gone up, not down. So it clearly is not related to that at all.
Yeah. Okay, are there some people who should not get vaccines?
Yes, people who have serious immune deficiencies should not get live virus vaccines. They can get the killed virus vaccines, but the live virus vaccines, although those vaccines have a very weak amount of the disease, if you have no immunity or very little, you might be at risk for getting the disease from those. And that's the group that we try to protect by the people around them all getting the vaccine instead.
Oh, okay. And now haven't we, you mentioned measles and mumps, have we gotten rid of most of the diseases we vaccinate for, or I guess obviously not, right?
Well, we've actually had some major measles epidemics and mumps epidemics in the past 2 years, largely related to people traveling overseas, getting those diseases from somebody overseas, bringing it back to the United States, and then there are some communities where the number of people vaccinated against measles and mumps has fallen due to people being complacent about it, and so then it ended up spreading to those other people with them getting quite sick.
Yeah, and does Baltimore County offer vaccinations at no charge? How does that work?
Sure. Children who meet criteria can get vaccines for free from our health centers. Basically, a child would qualify as long as they don't have private insurance that would pay for vaccines.
Okay.
And families would just need to call the county number and find out which is their closest health center and get it there.
Okay, that's good.
There are some adult vaccines that we get under special grants and things like that. So if an adult has a need for something, they may want to call either the general number or call 410-887-2705 and find out if it's available through a special grant.
Okay, and children in Baltimore County Public Schools are required to have certain vaccinations in
Yes.
order to attend school, right?
Yes, we do extra clinics in August and September to make sure that any child who needs them before school starts, that we can make sure they can get it, so there are no risks of them being excluded from school because they didn't get their vaccinations.
Okay, and we are right in the middle of flu season. Talk about the flu vaccine, please, and is it too late?
No, you can still get flu vaccine, and actually the health department still has flu vaccine available, both the shots and the flu mist, which is more pleasant for many children and young adults. It's only available for people under 50 who are basically healthy, but we have both vaccines available, and if they call the health center that's near them, they can get it for free.
Okay, and otherwise they can go almost anywhere, the drugstores, a lot of the
Yes.
grocery stores, private doctors' offices.
Yes.
Now, some people talk about feeling like they got the flu from the vaccine, but is that really true, or?
No, a small group of people, maybe 5%, will get some aching for a day.
Okay.
But it's quite different from getting the full flu kind of thing, that you can't get a full case of flu from the vaccine.
Okay, now what about, I'm hearing a lot about shingles for seniors as being an important vaccine.
So shingles is a disease for people who had chickenpox when they were younger, and then the chickenpox virus hides out in their nerves and basically stays dormant. And sometimes for seniors that gets reactivated and occurs as a very painful rash, usually along a certain distribution of nerves, and it's called shingles. And it's a very painful thing to get. There is a vaccine to prevent that, and it's recommended that all adults over 60 get that vaccine.
Over 60, okay, so over 60 you want to get the shingles. What about different ages of adults? You mentioned tetanus. Are there other vaccinations that people should be getting routinely?
Well, as we mentioned, we're now recommending that adults get the pertussis. Usually they'll get it as a combined pertussis tetanus, so it's called Tdap.
Is that the whooping cough?
That's a whooping cough kind of thing, and you can get it as a combined vaccine. It's especially important for adults who have any contact with babies.
Okay.
So that could be your own children, or it could be being a grandparent or a child care provider,
Sure.
or even being nice to your next door neighbor who maybe has a baby kind of thing.
I guess so.
Kind of thing. So now anybody of any age can get that vaccine.
Okay, so is the idea just to keep in regular touch with your family physician?
Yeah.
And
The other adult vaccine that's recommended is a pneumococcal vaccine, again for the over 60 group.
Okay, pneumonia. Great. Well, thank you very, very much for sharing this important information with us.
Good. Pleasure to do so.
Sure. And thank you for watching. We'll see you next time on Hello Baltimore County.